Hello, Dr. Sweke here, and welcome to today's lesson. In today's lesson, I'll be sharing instructional tips and strategies to help our elementary learners and children with speech and language impairment. What is speech and language impairment? Or what is a speech and language disability? Speech, language impairment, speech-language disability is a communicative disorder that interferes with the development of language skills in children and emergent learners who have no hearing loss. Speech and language impairment typically affects a child's speaking, listening, reading, and writing. Speech and language impairment is actually one of the most common and affects approximately about 7 to 10% of children and emergent learners in kindergarten. It is important to realize that due to genetic differences, speech and language impairment symptoms may vary from child to child or person to person, with symptoms manifesting or showing up in various forms and ways. There are three basic types or forms of speech and language impairment. They are articulation disorders, which are the errors in the production of speech sounds that are usually related to the anatomical or physiological limitations in the skeletal makeup or the neuromuscular support for speech development and speech production in the individual. Articulation disorders or errors typically manifest in form of omissions, substitutions, and distortions. The second basic form of speech disorder, fluency disorders, which are difficulties manifesting as a result of challenges with the rhythm and the timing of speech, usually showing up in form of hesitations, repetition, and stuttering. And the last type of speech impairment, voice disorders, are challenges and problems with the quality or the use of our elementary learners' voice resulting from disorders in the larynx. Voice disorders have to do with the quality, the pitch, the loudness of our elementary learners' vocal quality. Symptoms indicative of a speech or language impairment include being late to put words together into sentences, struggling to learn new words to make conversations, having difficulty following directions and instructions, especially because the directives were not understood, and making frequent grammatical errors when speaking. I'll be sharing 7 tips and strategies to support our elementary learner with speech and language impairment. Tip number 1. Using multiple communication entry points. When elementary learners use more than one sense at a time, their brain is stimulated in a variety of ways. As such, the use of multiple channels to communicate, including flashcards, puppets, and audiobooks, are great tools to help support and boost the oral language skills of our elementary learner. Tip number 2. Using gestures to support oral communication. It may be necessary to use gestures and exaggerate these gestures in trying to support our elementary learner, especially with receptive language challenges, to understand the meaning of a word or sentences being conveyed to them. Tip number 3. Using visuals and images to support communication. Pictures, images, and photographs are great visual aid tools that support and assist an elementary learner in their speech and language acquisition, especially as a picture or an image is known to be worth 1,000 words. Tip number 4. Modeling correct speech patterns. A great way to support our elementary learner and develop their speech and language acquisition is to model the correct speaking patterns or correct articulation patterns when speaking to them, and giving them time to rehearse and practice without necessarily correcting their speech difficulties. The rehearsal time to rehearse what was modeled to them is necessary and a great way to boost and support our elementary learner. Tip number 5, using actual objects to communicate. Teaching and understanding of words and concepts, especially through the use of objects or materials and tools that are of interest to our elementary learner, is a great way to provide a link between the information being presented while also activating prior knowledge or just making that connection from actual objects to the abstract concept being taught. Tip number 6, speaking directly to our elementary learner. Speaking directly to our elementary learner is a great way to sustain their attention to conversation while also modeling or displaying conversation or language expectations to them. Tip number 7, being patient. A great supportive tip is to be patient both in listening and speaking to our elementary learner with a speech and language impairment. It is necessary that they are not rushed or they don't feel pressure, especially when they're trying to communicate or participate in discussions, as these may lead to frustrations and a total shutdown. Again, it is necessary to remember that speech and language impairment or speech and language challenges vary from child to child and can look different from one elementary learner to another elementary learner. Early evaluation and intervention, especially in collaboration with the services of a speech and language pathologist, makes a great difference in the strides and progress that our elementary learner with a speech and language impairment would make. To help us, I have created a list of these tips and strategies. Please visit my website to download a copy of these tips. Thank you for learning with Dr. Osweke today. See you in the next lesson.